Okay, your timer is on, and here is your question.
Okay. Okay.
14 seconds. Timer is going. I'll give you 1 minute to read. Okay, maybe you can hear the bell. Okay,
Yeah.
if you have read and
Okay.
understood, considering it communication skills station, kindly please begin.
Okay. So I'll enter the room and
Yes.
I will see
Present
the.
yourself.
Yeah. So hello, I'm Dr. Jaff. I'm one of the exam candidates today. May I
What is
confirm
your
your name and
Okay, what is your candidate number? Okay, done. All right.
Yeah.
Then
Okay. So may I confirm that you are the mother of this child that's brought to the hospital today?
yes, I'm the mother of X. Where is my
Oh,
child? When can I meet my child?
okay.
Are you
Please.
the doctor who is operating on her? Where is my child? Can I meet her?
Yeah. Okay. Please just can we sit down and talk about the issue that and
What
we'll talk
issue?
about your
What
child.
issue, doctor? I'm really panicking. I'm really worried. Where is my daughter? Where is my child?
Okay. Can we? We'll sit down and we'll talk about it. Uh, your daughter has been brought to the hospital today by her teacher. So and she had tummy pain. Okay, and we think that she had what we call acute appendicitis. Do you know about that? Do you have
No,
any
doctor,
idea?
I have no idea what that situation is. But I want to meet with my child. Where is my child now?
Okay, I'm sorry that you haven't been contacted before. I will talk about what happened today. So she's brought to the hospital because of the tummy pain when she was at school by a teacher, and we think she had acute appendicitis, which is an inflammation of the part of the bowel or part of the small bowel that's inflamed. So we had to um, do, and we had to decide not as soon as possible to be operated on her.
But
And
why do you need to
my
operate on
consultant is on
her?
the way.
Why
Uh,
do you need to
uh,
operate on her? Why can't you just give her medication and send her home?
this is what this is the best in this situation because that's the best option. In this situation, we consider this is an emergency, so we have to, um, based on suspicion, we had to take her to the OR. My consultant is on the way. I'm not the one that's operating on her. I'm here to give you the information and to clarify and whatever questions you have.
What do you mean? Who is the surgeon who is operating on my child? And why do you need to operate only on the basis of suspicion? I don't understand, doctor. Are you not taking my child seriously? Where is my child? I want to meet with my daughter.
So we cannot, you cannot meet the doctor. He's Mr. Mann, that's my consultant, which he supposed to operate on her.
Oh,
I'm
Mr.
sorry that you
Man.
cannot
Oh, no,
see
no
her.
way, Mr. Man. Mr. Man is the person who is the doctor who killed my husband. He cannot be operating on my child. No way, doctor. Stop this operation immediately.
I'm sorry for what happened before and about your husband. I think we can talk about that. And in this situation, that's the best we can do for the child. We, I can give you. I'm confident that the team that are working, they do their best to for your child, and that's what we think is the best for her.
No, doctor. What about the scar? It will leave a big scar. She's a girl, you know. It would not be good for her. Why do you even need to operate on her?
Yeah, unfortunately, I'm sorry to tell you that there might be a scar, a small scar, and in some cases it might be even bigger if they need to, if the inflammation is went to other areas of the tummy. So and that's the best for her. So as before the inflammation goes to other organs, and in her case, especially for which is there are risks, more risk in child than in adults.
Explain why.
Yeah, usually in children there's less fat inside the tummy, so there might be more complication. Unfortunately, there might be more risk in this situation.
Hmm?
But I'm sure they will do their best, and we'll do our best uh,
But
to
doctor,
take that in consideration.
I've heard that there can be infection and this can lead to difficulty in reproduction in later ages for a child. Is this true?
Yeah, that's unfortunately a possibility that might happen, especially in female, because these organs are usually closer to each other, and this inflammation might go uh, to other organs. But I'm sure they will try their best to prevent that. I'm
Are
sure
there,
she's in a good hand.
what are other risks associated with this operation that you're doing on my child, doctor? I'm really
So
worried for my child. I don't want you to, Mr. Mann, to go ahead with this surgery.
yeah, I can tell you about the risk. There are some risk in terms of infection. And there are a risk of bleeding uh, during the operation and after the operation, usually. And there are some risks of infertility for future. Uh, these are some risks, but that doesn't mean it will happen during the operation. These are usually very, the chances are very, very low, hopefully.
Okay. Are you 100% sure that this is appendicitis or whatever you are telling me?
No, I'm not sure that it's 100%, but based on suspicion, and usually in this case, this is the best we can do. I mean, in these, usually it's based on suspicion for appendicitis. So uh, that's what we have in terms of getting to the diagnosis.
Okay. Can you hear the bell? How would you close the consultation?
Okay, so do you have any other questions? Do you have
When would I be able to meet my child, doctor?
hopefully after the operation, after we make sure that he's okay when he comes out of the operation, and make sure that he's awake, we will contact you as soon as possible.
Okay. Thank
Okay,
you. Thank you.
okay, and I will summarize uh, the situation. Should I summarize it?
No.
Okay.
Uh, okay. Now I